Panel?
Thank you.
Thank you.
Since we have no more questions, we'll call up the next panel. And the panel is on issues and challenges facing the Department of Public Health. We have Elaine Howell, California State Auditor, Robert Joy, Senior Consultant, Public Consulting Group, and Jean Iacino, Deputy Director, Center for Healthcare Quality, Department of Public Health. Thank you and welcome. When you're ready.
I didn't know. Thank you, Mr. Chairman, Chairwoman Brown. To my right is Tammy Lozano. I asked Tammy to join me at the table when we get into question and answer. She was the audit manager on this particular project. For the record, my name is Elaine Howell. I'm the California State Auditor, and I'm going to give you a brief overview of the audit report that we did on Department of Public Health and their oversight with respect to complaints and investigations that they're responsible for conducting, and certainly the district offices are responsible for conducting out in the field. We issued this report in October of last year. 5 key issues that I'm going to share with you today. Clearly, as Chairwoman Brown indicated, a backlog of complaints. When we issued our report at the time frame we used was as of April of 2014. They had about 11,000 complaints, so I'll talk about that a little bit. Certainly, we'll be discussing staffing levels, some of the constraints that the department has been dealing with over the years as far as trying to recruit and retain individuals to perform these kinds of services, the quality of the complaints and the investigations themselves as far as corrective action and assuring whether or not corrective action is taking place. With respect also to oversight of complaints, looking at timeliness and consistency from one district office to another, and then the appeals process and how they manage the appeals process. The final issue, very brief issue that I'll discuss towards the end, is reports to the legislature and whether or not the Department of Public Health has been complying with the requirements to report information to the legislature to keep the legislature informed. So the first issue, as Chairwoman Brown indicated when in her opening comments, as of April of 2014, we identified 11,000 open complaints, both complaints that have been filed by the public or actual complaints or incidents that the facilities themselves have to report to public health. In addition to that, included in that 11,000 is about 1,000 complaints with respect to certified individuals who are working at these facilities providing care to loved ones in the facility. So that 11,000 is comprised of those various buckets. Again, as Chairwoman Brown indicated, when we completed our audit, at that point in time, many of these complaints had been identified as a high priority. For example, an immediate jeopardy, which is something that is, serious harm to an individual residing at that facility, up to and including death. So those are various serious complaints. Other complaints may be non-immediate jeopardy, but they're high. They're designated as a high risk issue. Again, a situation where healthcare services needs to get out and do an investigation relatively quickly. So 40% of the open complaints and these EIRs, these facility reported incidents, had this immediate jeopardy or non-immediate jeopardy designation. Again, meaning we need to, as a state, get out there and investigate promptly. The average number of days these complaints were open at the time we completed our review was a low of 14 days, but a high of over 1,000 days. So you're looking at a couple of years, 3 years in some instances. For 8,000 of these 11,000 complaints, Public Health had not yet completed its investigative process or the investigative phase of the process. For the immediate jeopardy, we present a table in the report that lays out these complaints. The immediate jeopardy, again, those are ones that need to be, health services needs to get out there within 24 hours. Because this is a situation that is a serious risk, endangerment of a resident at the facility. There were 368 of these cases, and the average amount of time those cases were open was about 340 days, so nearly a year. So as you can see, very serious concerns with respect to this backlog and the amount of time it's taking health services to investigate these complaints and determine whether or not there's a significant issue. As far as oversight of the complaint process itself, whether or not public health is actually monitoring and managing the various district offices that have to carry out these responsibilities. And what we found both for the complaints regarding facilities and these complaints I refer to as for certified individuals, there really was no systematic tracking or monitoring of the complaints each of the facilities were, each of the district offices were trying to investigate and hopefully close out and get some corrective action taken. So that was not occurring both for facility complaints and for complaints against individuals. And there's two different entities. There's a professional certification branch within health services that is responsible for, public health now, responsible for investigating individuals. The district offices are actually investigating facilities. But again, neither place were we seeing real strong monitoring and tracking of these complaints. So that was a concern that we had. With respect to timeframes, there are clear timeframes in state law, 24 hours, as I indicated, to initiate a complaint if it's an immediate jeopardy, very serious situation. 10 days if it's less than that, if it's a different type of severity as far as non-immediate jeopardy. But what we didn't see is a specific time frame for completion of that particular complaint against facilities or a complaint against a specific individual. So that was a concern that we raised in the audit report. In addition, with respect to complaints against individuals, unlike the 24-hour requirement for a facility or the 10-day requirement for a complaint against a facility that may not be as serious as immediate jeopardy, there is no statutorily required time frame for a professional certification branch to get out and investigate a complaint against an individual. And this was a very serious concern to us because we looked at 33 complaints during the course of the audit against individuals. 14 of those complaints, there had not been an assigned investigator for more than a year actually assigned to investigate that particular complaint. So a complaint comes in about a particular individual, the care that they're providing in a facility. Public health receives that complaint, but yet hasn't assigned an investigator for at least a year to go out and investigate that particular complaint. So again, very serious concerns with respect to that. Staffing levels, we visited 4 district offices. 3 out of the 4 district offices that we visited said their staffing is a major concern for them. It's difficult to recruit individuals, particularly in the San Francisco office, and it's difficult to have enough individuals to manage the workload that these district offices have to deal with as far as complaints coming in. As the previous panel gentleman from LAO talked about, there was a report that during the course of our audit that had been conducted by Hubert Consulting. There are some specific recommendations in that report with respect to staffing, with respect to reclassifying positions so that they could be hopefully attract more individuals to perform this function on behalf of the state of California. So there are some issues with respect to that. A key issue that we identified during the course of the audit is public health has not really done a staffing analysis by individual district office. They may do a staffing analysis at a statewide level and try to identify the number of staff necessary to perform this function statewide, but district office by district office, at the point we conducted our audit, we hadn't seen that type of analysis, and that's one of the things we recommended that the department needs to pursue. Now, with respect to investigations of individuals by this professional certification branch, there were some temporary measures that PCB, as it's referred to, took. They actually were able to obtain some temporary positions good for a couple of fiscal years, fiscal year 14-15 and 15-16, try to deal with this backlog, this 1,000 complaints that they had at the point in time we conducted our audit. But again, it's a solution. It helps, but it's a short-term solution. It's only good for another year. So again, we believe that public health needs to pursue a long-term solution with respect to being able to investigate complaints against individuals promptly. As far as the consistency and quality of complaints, with this area we were looking at whether or not there was consistency from one district office to another as far as assessing a complaint and prioritizing that complaint, particularly with respect to complaints filed by facilities. And I think this is an area that the department really needs to focus on, because we noted that about 76% of the complaints that the department receives are these entity-related incidents. And facilities have to report incidents to public health. But many of these may not be serious enough to require an immediate response or a response within 10 days. So if they do a better job and work with their district offices to do a better job of classifying these reported incidents, then they would be able to devote the resources to the more serious complaints that they receive either through the public or perhaps through the facility, and certainly be able to focus on the complaints with respect to individuals. So we think there's some work that could be done there. In addition, when we were out at the district offices, we noted that many of the district offices went out and investigated a particular complaint, noted a deficiency, notified the facility that there was a deficiency, but did not ensure that that facility provided a corrective action plan. They are required to submit a corrective action plan, I believe, within 10 days. And what we were seeing at these district offices, well, did you verify that you got a corrective action plan? In some cases, the answer was no. In some cases, the answer was yes. But even if the answer was yes, what evidence did you receive from the facility that they followed through with that corrective action and corrected the deficiency that you had notified them of in the past? And we weren't seeing that as well, as far as making sure that you're providing proof, the facility is providing proof that a particular deficiency has been corrected via their corrective action plan. I talked a little bit already about the EIR investigations, the oversight as far as public health, providing oversight to these facilities with respect to these EIRs. Again, this was something that was noted in the reviews that the federal government through CMS submitted some correspondence to California back in 2012 and again in 2014. And some of it was related to consistency of intake, consistency of prioritizing complaints that come in, and evaluating complaint processes at all the district offices. So those were some of the recommendations or important things that the federal government was expecting California to see. One of the things, as the gentleman from LAO talked about, is the concerns that were raised in L.A. County as far as L.A. County making decisions to close a complaint if it was an anonymous complaint, so close it as no action necessary. They had kind of an unauthorized policy to do that, and that was a concern. And as again, the gentleman from LAO talked about, and we looked at, the Los Angeles County Auditor did some analysis. The Department of Public Health actually went out and did their own analysis of L.A. County, because as again, you've heard, L.A. County, the state contracts with L.A. County to provide this type of oversight in L.A. County. We believe, again, public health needs to do a better job, just as the federal government indicated in their correspondence to public health in 2014, because of, again, some of the backlogs and the decision-making that was occurring in Los Angeles. As far as the appeals process, we had some concerns with that. There are specific requirements related to appeals. So if a facility appeals a case, it's my understanding public health uses healthcare services to adjudicate the administrative aspects of it. And what we were finding is some of the decisions were not occurring within the time frame. There's a 60-day time frame for making a determination, and that actually notifying the complainant and notifying the facility of the actual outcome of that particular complaint. In addition to that, with respect to certified individuals, and I got my testimony wrong a little bit, the appeals related to facilities stay within public health and their licensing division. Appeals related to a certified individual. So if I'm an individual working at a facility and I've been accused of abuse, I can appeal that particular case, and that is where public health uses healthcare services to adjudicate that particular situation. Again, there's a time frame tied to that, similar to facilities. And again, it needs to be done within 60 days. We looked at 10 appeals. Those were not being completed within 60 days. And then the notification, for those that were completed, there's a 30-day window, again, to notify that individual of the decision, and certainly to notify the facility that individual works at. And there's certainly the obvious concern there is if it's a complaint that is substantiated, we need to be very prudent and dutiful as far as getting that individual out of that facility or disciplining that individual for the improper care of folks in those particular facilities. The last issue was related to reporting to the legislature, failing to report all required information to the legislature. We looked at 4 years of reports. The department is required to report annually on the number of facility-related complaints that it has investigated, the number of those complaints initiated and completed within the required time frames, whether it be in immediate jeopardy or others. 2 of the reports we looked at, they included all of the information. 2 of the reports, they included the number of complaints filed, but they did not necessarily include information related to the timeliness of those initiating those particular investigations. So those are the 5 key issues. We have a variety of recommendations. We gave them specific time frames, public health, to complete some of these recommendations. Some were as early as January of this year. That was related to some of the information related to metrics, getting some more information published on their website. Some of that we believe they've accomplished. There are some recommendations that we expect to see completion by May 1st of this year, and then there are some others related to prioritizing, going out and evaluating district offices, assessing their staffing, looking at their staffing model. Many of those the department has asserted to us in the 60-day response, that's the first one we've received thus far, that many of those will be completed by October, by the 1-year response, by October of this year. So we look forward to seeing more responses from the department. Again, we have the 60-day response. We've seen some progress, but certainly we will hope and expect to see much more progress by April of this year, which is the 6-month response, and then certainly by October of this year when we receive the 1-year response from the department. Chairman Bonta and Chairwoman Brown, that completes my presentation. Certainly we're open to questions, or I'm not sure how you want to handle this. Go to the other panel members, or...
We're going to go through all the panelists, and we'll do questions for any members of the panel at the end. Thank you, Ms. Howe. Let's go to Mr. Joy.
Good afternoon, committee members and Chairwoman, Chairman Bonta and Brown. My name is Robert Joy. I'm a senior consultant with Public Consulting Group. Public Consulting Group acquired Hubbard Systems Consulting last year. Hubbard Systems Consulting delivered this report to the Department of Public Health's licensing and certification program that did this assessment of their capabilities as well as remediation recommendations. So I'm going to go through kind of some background of that report, talk about some of the findings and observations we had, as well as some of the recommendations. A little bit of background about myself. I've got about 25 years of experience in healthcare performance improvement and quality management. Over half of that is working with state, local, federal health agencies to help them improve the way they do business. So some contract background on this report. Hubbard Systems Consulting was awarded a contract to perform this assessment in August of 2013. And the purpose of this report was to identify any issues, barriers, or challenges that the department had in meeting its regulatory requirements, both its state and federal regulatory requirements around surveys, complaints, and other activities that the licensing and certification program was responsible for. And so we had about 4 different staff working on this throughout the course of the project. I was at the beginning of the project a co-author and co-surveyor, and by the end of the project I was the project lead. We delivered the final report in August of last year. So in terms of content of the report, we interviewed hundreds of staff. We reviewed dozens of documents, talked to external stakeholders, and we provided the department with an initial assessment that looked at various potential challenges the department would have in delivering on its promises of the licensing and certification program around leadership, strategic planning, metrics, its workforce, its operations. And based on those initial findings, we did a much deeper dive in this gap analysis where we looked at 21 different areas in 4 different categories. And I think the findings are pretty consistent with what you heard from Ms. Howell, what you've heard from previous reports and from other auditors or entities. I'm going to summarize those findings. But first, I think it's important to say that we also identified some strengths. So although the focus of the report was to identify areas for improvement, one of the key strengths that's worth noting is the dedication and the professionalism of the department's employees and staff. We've got some really good people that are working over there and in the district office, and I think it's really important to recognize that resource that's available to the state. So in terms of opportunities for improvement, clearly time frames that the department's resolving complaints, issuing citations, collecting civil monetary penalties. In addition to the turnaround time frame for the surveys, there's really a huge opportunity for improvement there. But we wanted to go a little deeper in terms of the operational opportunities for improvement. One of them is around standardization and automation. So based on the variability of performance across the district offices in terms of complaint resolution as well as survey outcome, it became apparent that despite clarity in the regulations and clarity in perhaps written processes, that there were not enough controls in place for staff and managers to make sure that they were following processes appropriately. And so the lack of automation we believe kind of contributes to that lack of standardization. And a variation on that theme is timekeeping. Assemblyman Mathis, you talked about the workload studies and how are we going to estimate how many staff we need. One of the things we found was the reliability of the timekeeping data and the variety of systems used to keep time. I understand the department's working with maybe working with a contractor to fix that, but that's an example of something that automation could really improve in terms of understanding the effort required to do the blocking and tackling of the department and the program. Another area that was an opportunity for improvement were the kind of HR functions, recruitment, hiring, onboarding, training, retention, succession planning, leadership development. Just a lot of real opportunities there in terms of reducing turnover, keeping good people on board, and making sure people that are excelling have opportunities for promotion that actually are followed through on. Another area is strategic planning and performance measurement. We really felt that it was important to be as clear as possible that the leadership describe as clearly as possible what its objectives are, develop measurable objectives that would describe to the staff and stakeholders what is expected of the program, and to provide staff, stakeholders, and the public information on how the department is doing against those key performance indicators. Another area, again, Ms. Howell brought this up, is the LA County contract. We felt that for a variety of reasons, mostly because of the size of that contract, it's about a third of the state in terms of the patient and licensed entity volume that needed to kind of move up in the organizational food chain. So I want to talk also about recommendations. So those are in general were the findings in the assessment of gap analysis. Recommendations, we had 21 different action plans, 4 different categories, over 100 different actions that the department would be taking over the course of 2 years. And we prioritized those based on 2 factors. So one was how urgent were they to undertake in terms of having some sort of foundational, transformational change to the organization. Assemblyman Chavez, who isn't here right now, talked about whether one should spend resources or energy adding more staff to the system or to the program, or whether there should be some time to basically fix the factory. And so that's the essence of a lot of our recommendations in terms of those that we felt were most urgent. We have some HR-related ideas that we sort of time towards the latter part of the implementation plan, but a lot of the urgent recommendations are really about kind of foundational transformational change. Another set of characteristics around trying to prioritize these, we're thinking about which were those that the department could act on right away without additional approvals from control agencies or the legislature, and which were those that might require additional budget or additional oversight or additional federal or state mandate to support. So again, we really wanted to try to make this action plan as practical as possible, especially for those items that were on the front of the list. So in terms of those urgent priorities, leadership development, governance, and strategic planning, making sure that the leaders have the tools to articulate what the vision is, what the objectives are, and how best to measure those. Related to that is developing key performance indicators that the department and stakeholders could use to objectively assess how they're doing, identify in what areas or what district offices there might be need for improvement, and to basically track whether those improvements are happening at all. Internal and external stakeholder engagement. So we've seen that the department's stepping up its efforts to really engage with the public and let them know not only what the problems are that it sees, but what it's doing to try to fix those. And LA County oversight. So again, we've talked about that quite a bit. The department really needs to push up in the organizational structure, as well as devote more resources to the oversight of that huge contract to make sure that some of the shortcomings from the LA County oversight don't occur again. So that's a summary of the background, the findings, and recommendations from our report, a little bit about the process. Thank you to the committee for inviting me here today, and I'm happy to answer any questions.
Thank you, Mr. Joy. Let's finish up with our last panelist, and then we'll go to questions from members. Ms. Iacino.
Thank you, Chairman Bonta and Chairwoman Brown. Good afternoon. I am Jean Iacino. I'm the Deputy Director of the Center for Healthcare Quality in the California Department of Public Health. And the mission of the California Department of Public Health is to protect and improve the health of Californians. In the Center for Healthcare Quality, the licensing and certification program provides regulatory oversight to over 30 different healthcare facility types with more than 8,000 individual healthcare facilities, and we assess their compliance with state licensing and federal certification regulations. Under contract with the Federal Centers for Medicare and Medicaid Services, the L&C program certifies healthcare facilities for participation in Medicare and Medicaid. We conduct these activities in 14 state district offices and in 4 Los Angeles County offices under a contract with the Los Angeles County Department of Public Health. In addition, the Professional Certification Branch is responsible for all aspects of the training approval, certification or licensure, criminal record clearance, and investigation of complaints for 200,000 certified nurse assistants, home health aides, certified hemodialysis technicians, and nursing home administrators. As noted by both the Bureau of State Audits and Hubbard Systems Consulting, the L&C program faces a significant number of open aging complaints and entity-reported investigations, and we need to improve our performance in this area as well as in our general operational effectiveness. The licensing and certification program has taken significant steps to address the issues raised in both the auditor and the consultant's reports. The governor's budget for fiscal year 2015-2016 proposes substantial increase in the funding and staffing for CDPH and Los Angeles County to more efficiently accomplish our licensing and certification workload, including complaint investigations, and to reduce the number of open aging complaints. The proposals include 237 additional positions for the state and an increase of $9.5 million to augment the Los Angeles County contract to address workload identified in the licensing and certification program's November estimate. This year, we changed how the program measures some of the critical data elements that go into our estimate, including the standard average hours, the workload projections, and workload carried over from prior years. Based on these changes to key data elements in our estimate formula, our November estimate indicates that the program requires additional funding authority and staff to complete the mandated workload, including completing complaint and ERI investigations that remain open from prior years. Additional activities that we have undertaken to address issues raised in both of the reports include developing a work plan for implementing the remediation recommendations of the Hubbard report. The work plan, along with updates on our progress, is posted on our website. Holding 3 public stakeholder meetings, the first of these in September of 2014. Developing a strategic map that was posted for stakeholder review and comment. Increasing our oversight and supervision of the Los Angeles County contract performance. Creating a data integrity group for ensuring the quality of our performance data. developing a contract scope of work for recruiting and retaining nurses, recruiting for a stakeholder liaison and a communications specialist, nearing completion of a business process redesign review of our Central Applications Unit and our Professional Certification Branch Investigations Unit, testing tablets for use by surveyors to replace laptops in the field and increase the efficiency of our investigations, developing a centralized citation tracking log to improve the efficiency of issuing and completing our citations, modifying our data collection processes to improve our tracking of the timeliness of open investigation complaints against certified nurse assistants, developing and updating written policies and procedures to ensure appropriate supervisor review of investigations and to reduce variability among our district offices, developing criteria for reviewing complaint and ERI prioritization and investigation quality, and conducting reviews of samples of complaint and ERI investigations. We piloted these reviews in Los Angeles County, and by October 2015, we will use these criteria to monthly review a sample of investigations in district offices statewide. We have filled 17 of the 18 new positions that were established in the 14-15 budget to improve the timeliness of investigations related to certified nurse assistants, and we are conducting quarterly visits to each district office to ensure compliance with policies and procedures, including those related to complaint and ERI closure. During these visits, our branch chiefs discuss complaint and ERI investigation monitoring with district office administrative, supervisory, and management staff. Beginning in November 2014, the L&C program began publicly posting metrics on the volume, timeliness, and disposition of complaint and ERI investigations in long-term care facilities and investigations of complaints against certified staff. The second quarter metrics with data as of December 31st, 2014 show approximately 4,500 open complaints and 7,300 open entity-reported incident investigations for long-term care facilities. The metrics also show that we complete 70% of complaint investigations and 77% of entity-reported incident investigations in 90 days or less. In addition, we are initiating 96% of all immediate jeopardy complaints on site within 24 hours and 96% of all non-immediate jeopardy complaints within 10 days. At any time that our surveyors identify an immediate jeopardy situation at a facility, we immediately notify the facility administration and do not leave the facility until the facility provides a plan to immediately address the problem. Finally, we have our second quarter metrics show 976 open complaints against certified individuals and a completion of 27% of those investigations in 90 days or less. Beginning with our third quarter metrics that we will post in April, these statistics will be broken out by district office. This will provide a management tool to help us identify both problems and best practices in district offices, enabling us to address problems and disseminate best practices, helping to improve our performance statewide. These metrics will also help us to continue to assess variations in workload among district offices and adjust staffing over time if needed. The additional staff requested in our budget change proposal will enable us to reduce the number of open complaints and ERIs, decrease the average number of days to close a complaint or an ERI investigation, and increase the percentage of immediate jeopardy complaint investigations initiated in 24 hours. Both the Bureau of State Audits and the Hubbard Systems consulting reports raised concerns about our program's oversight of the contract with Los Angeles County. We have initiated multiple activities to monitor Los Angeles County's performance. In March of 2014, the L&C program conducted an on-site quality review of the long-term care and complaint and ERI investigations conducted by Los Angeles County between January of 2009 and December of 2013. This review included 136 skilled nursing facility complaint and ERI investigations, interviews with Los Angeles County staff, and observation at the 4 Los Angeles County offices to assess compliance. We issued a report of this review in June of 2014. Our review concluded that Los Angeles County's unsanctioned policy of case closure had limited impact. However, we did identify incorrect prioritization that led to delayed investigation. We identified deficiencies in Los Angeles County's use of the principles of investigation and documentation, and we identified that Los Angeles County staff failed to appropriately and prioritize and manage complaints and ERIs. As a follow-up to this March quality review, we investigated 1 possible immediate jeopardy and 2 non-immediate jeopardy high complaints and ERAs that our review indicated had not been investigated by Los Angeles County. Our investigation did not substantiate the allegations raised in those complaints. In November of 2014 and again in March of 2015, the LNC program and the Centers for Medicare and Medicaid Services conducted joint site visits in Los Angeles County. The November visit followed up on allegations from a Los Angeles County nurse surveyor regarding falsification of complaint information and investigations. Based on the joint review between our program and CMS, we found no malicious falsification of information. However, we did find that Los Angeles County had provided staff with some inaccurate processing instructions that were not consistent with CMS requirements. The LNC program asked Los Angeles County management to ensure adequate and timely clerical support at the district offices and monitoring of complaint intakes, and provided accurate instructions based on CMS guidelines. Also during the November 2014 visit, the LNC program conducted on-site meetings with supervisors and staff at 2 of the Los Angeles County district offices and reviewed federal workload performance. During the March 2015 visit, we further evaluated database entry and prioritization of complaints and conducted on-site visits at 2 more of Los Angeles County's district offices. CMS also provided training on enforcement processes and timelines during this visit. The Licensing and Certification Program has provided multiple trainings to Los Angeles County supervisors, managers, and field staff on topics including prioritizing complaints and ERIs, principles of investigation and documentation, determining the severity and scope of deficiencies, the federal abbreviated process surveys, and supervisory review of surveying complaints and the enforcement process. In addition, we have several quality improvement projects that focus on Los Angeles County, including reviewing deficiencies issued by Los Angeles County to assess the evidentiary support for the deficiencies issued and the selection of criteria for determining deficiencies, including reviewing samples of surveys conducted using the federal abbreviated survey process, and also reviewing samples of intakes to assess prioritization. We continue to provide on-site oversight of Los Angeles County. We have hired a retired annuitant and have administratively established and filled 2 of the 3 positions that are requested in a budget change proposal this year to provide on-site oversight. We will establish additional performance metrics in the new contract with Los Angeles County. These metrics are the subject of contract negotiations that are now in progress. We are committed to improving the timeliness and effectiveness of our licensing and certification activities, and we thank you for the opportunity to share with you our progress to date.